First time the ICL has come with a EDOF mode, which is called extended depth of focus. That means it can give you a vision for distance and also correct your vision for near. So this patient tomorrow should be seeing for distance clearly, and she should also be able to see her mobile or read the newspaper or a book.
VDCTZP. If we decide to donate our eyes after death, then it is absolutely useful to someone. My name is Rigzin Lhamo Bhutia and I'm from Sikkim, and I'm teacher by profession. I'm 45 years old, and my right eye is -4 and the left is -4.5, and I've been wearing glasses for the past 21 years. Actually, I wear glasses at home, and in school I wear contact lens. So contact lens was not much of a problem, but then at home, as soon as I reach home, I changed to glasses because wearing whole day is a bit of inconvenient for me. So that's why I prefer glasses at home. I cannot see far clearly, and after this lockdown, COVID time, I had too much of screen time, and because of that, the vision has gone down. So that's why I thought now I need a permanent solution for this. My husband saw it on YouTube, Dr. Chaudhary, Rahil Chaudhary. So he was really impressed by his how he was explaining, and I thought we should go for this. I'm feeling good actually. I'm not at all nervous. The facility here is wonderful. So I just feel like at home right now. It's so good. The doctor explained to me that for very fine reading, I need reading glasses, but for little bit distance, it's okay. I don't need glasses for that. I was told like that, and Dr. Rahil, I had a word with Dr. Rahil, and he said, like, he'll send me back with a smile on her face. So I'm hoping for that.
Who is Rigzin Lhamo? Her age is 45 years. A person in the age group of 45 years has a power for a reading when the distance vision is corrected. So she needs two kind of corrections, for distance and for near. So her power for distance is -4 in the right eye, -4.5 in the left eye, and she needs an add of about 1 for reading. So now what we are going to do with this new generation of ICL, so this is the new generation ICL, which is called Evo Viva ICL from Star Surgical. And this generation of ICL is going to correct the vision for distance and also correct her vision for near. So which is the first of its kind. It's been launched internationally. It is FDA approved, and this patient is going to get the benefit of this lens. Hi Rigzin, how are you? Namaste, namaste. So you know you have a number for distance, right? Your age is 45. You also, if you use your glasses for distance, then for near you have to remove your glasses to read.
Yeah, that's the
Right. So you would prefer something where you can see for distance and near without glasses.
That's fine.
Right. So this is what we are targeting for you with this lens, which is called the Evo Viva IOL, which will give you correction for distance and will also give you your capacity to read without glasses.
That's good.
Right. So let us start with this. Can you please lie down? So I'm just repeating, her spectacle power in the right eye is -4. This. And the lens calculation is that the size of the lens is 12.6 and the power of the lens is -5. The ICL power in the eye is 1 diopter more than the spectacle power which is outside the eye. So this is the power And this is the lens. This is from Star Surgical, and the power is -5. And this comes with an additional focus for reading. So then we are about to start. Okay. We have put drops on your eyes, and the eye is numb with just eye drops. There are no injections at all, and there should be no pain at all. Right? All you have to do is just look at the light above you, like you're looking right now. The whole procedure should take about 5 minutes. So this is the lens which comes in the bottle. I brought it out. The lens looks exactly the same as a normal monofocal Star ICL. I'm placing it in the injector cartridge. So I'm loading the lens. So the lens is loaded. So this is in position. So we're doing the process under hydro insertion. So this is the lens opening up inside the eye. Whatever little strands of the visco are there during hydro insertion, so whatever little strands are there, we have removed those strands of visco. We are tucking in the first haptic, the second haptic, the third haptic, and the fourth haptic. So the lens is in position, the surgery is over. I just have to now hydrate the entry points, and that will be it. So even the points are hydrated. A little shot of antibiotic, and that's it. The surgery is over. Now, what is different? We would normally expect that in the optical area there would be rings for near vision. This lens shows no rings for near vision. It just looks like a normal monofocal lens. Evo Viva ICL. That is the full name of this lens. So we are removing the speculum, checking the intraocular pressure, slightly high. I'm reducing the pressure. This is normal, and we are done with the first eye. So, were you comfortable? Any pain? Nothing?
Not so much.
Just a feeling of touch? Yeah, just a little pressure. Wonderful. So we are done with one eye. We are going to prepare you now for the other eye. So for the other eye, we are shifting her to the next bed, from where I'll have a better access to the left eye. The other eye has a number of, if you see here, -4.5, -0.25 at 170. So it is minus at 170, so it will be plus cylinder at 80. So the steeper axis is the vertical axis. Now we will make our main entry at 80 degrees, so that we do a 0.25 flattening of the cornea, and so we enhance her spherical power and neutralize her cylindrical power. So the power will become 4.5, add 0.25 is about 4.75. So add 1 to it, 5.75 or 6. So the ICL, the Evo Viva ICL power should be about 6. So let us see here, and this is the lens. This is the Evo Viva lens. So the power is minus 12.6 and the power is minus 6 diopters, right? And this is a depth of focus lens. So now I'm taking position and I'm sitting not on the temporal side, but I'm sitting on the head end side. So my position is such now that I would be placing the main 3.2 port at 80 degrees. So we are ready for the left eye. IO, the two side ports, pupil dilator plus anesthetic, main port 3.2 at 80 degrees. The lens is out of the bottle. Again, I repeat, it looks just like an ordinary Evo ICL. There's no difference in the looks and the feel. The lens is loaded. A good loading is one which shows all these three holes aligned in one line and visible from the top. So this is a good loading. With these three holes visible, I expect my lens will open up the way it is supposed to open up, flat and parallel to the crystalline lens and over the iris. So this is the lens opening up over the iris. Now the next question is, should I keep it in this position or do I make it horizontal? So I'm turning it around to make it horizontal. My two haptics are tucked in. Why I made it horizontal? Because the calculations were based on the horizontal white to white. So that is what the position should be. But I've used a superior entry to neutralize the cylinder, that 0.25 cylinder. So I have scientifically tried to cover all the parameters that would give me the best outcome. So we are done. I'm removing the speculum, checking for the IOP. It's a little high, so I'm releasing some aqueous. Better, releasing a little more. Yeah, this is the perfect pressure. So the job is done. So 5 minutes both eyes, like I promised. No pain. Great. Just a little feeling of touch of pressure. Both the surgeries have gone very well. Absolutely perfect. So we'll take you out now. You could rest here for an hour or so, and then we'll discharge you. So you saw the first case of Evo Viva ICL in India. This was a bilateral implant. The patient had a number of -4 for distance, but when she used distance glasses, she needed another addition for reading. That means she needed a bifocal lens. A normal ICL would only correct for distance, and immediately as she gets a correction for distance, the very moment she would start needing reading glasses. Now, for the first time, the ICL has come with a EDOF mode, which is called extended depth of focus. That means it can give you a vision for distance and also corrects your vision for near. So this patient tomorrow should be seeing for distance clearly, and she should also be able to see her mobile or read the newspaper or a book. So tomorrow when we meet again, we'll check out whether she was able to do that and whether this lens delivers.
Since Dr. Sanjay was doing the surgery, I was 100% confident that it will be a successful surgery. I was prepared for that, and then it went off very well. Yesterday was like right after surgery, things were blurry, but then I can identify, I can see the road, like big things I can see, but the details I couldn't see yesterday because right after the surgery. Then I had a good rest at home, and as prescribed by the hospital, I took all the medications.
Can you remove your glasses now? We'll take your vision once, okay?
Sure.
Can you see what is written there?
V.
Now?
FK.
Now?
TDZP.
Now?
VDCTZP.
Now?
HPKSTZC.
Now?
ZPEHSRD.
Your vision distance vision is perfectly fine. It's 6 by 6. Now we'll check your readings. Are you able to read this line?
Okay. If we decide to donate our eyes after death, then it is absolutely useful to someone.
Okay, ma'am.
Okay.
Okay, ma'am. You are able to read the most detailed lines also properly now.
And this morning was much better, and right now it's completely normal. Like it's everything fine. Like I can see everything so clearly, and this is a wonderful experience. Like such a relief, actually.
Perfect. Right now you can see everything.
Yes, sir. I can see.
So can you read all this?
Yes, sir.
Just try reading if you
Cataract
can.
surgery, no stitch, no pain. Done under eye drops only.
Perfect. Okay, can you read?
Name, my Mrs Rigzin Lhamo Bhutia, age, gender, 45 years, female. Mobile number 98000.
Perfect. So this is font 9.
Sure, sir.
Right.
Okay,
so you're able to read font 9,
Yes,
and
sir.
it is just 24 hours.
Yes, sir.
Right.
Okay, yes, sir.
So you are in that age where you had a distance number and
Yes.
a near number.
Yes, sir.
So today you can read distance.
Yes, sir.
Today you can read near.
Yes, sir.
Of course, it is still the first day.
Yes, sir.
It gets better over the week,
Okay,
and
sir.
things keep improving.
Oh, sure, sir. Okay. So when can I start the screen working on screen, sir?
Say about 3-4 days from now, or maximum a week.
Okay, sir.
3-4 days is usually good enough. You work when you feel a little strain,
Okay, sir.
then you can take a break
Mm-hmm.
for say a few minutes,
Okay,
and you
sir.
can again sit back on your laptop.
Okay,
The
sir.
thing is, now there's a lens in your eye,
Yes, sir.
right?
Yes, sir.
Where there was not supposed to be a lens.
Mm-hmm.
The nature had not designed that
Yes,
place
sir.
for a lens, right?
Yes, sir.
So when the lens is there, your
Yes.
body has to, and your muscles of the body inside the eye have to readjust to them,
Okay, sir.
to that presence.
Mm-hmm.
So initially, when your muscles contract, relax,
Mm-hmm.
they are doing that as per the original program,
Mm-hmm. Mm-hmm.
which is designed for the body.
Oh, sure, sir.
Now they are slightly adjusting themselves
Mhm.
to this new thing which is in the eye.
Yes, sir.
So initially there could be a little strain for a day or two or a week,
Mm-hmm.
and after that your body will function very well.
Mm.
Was the surgery comfortable?
Yes, sir. Very comfortable.
Very comfortable.
Everything, the facility over here, everything is so good about this hospital, sir. And even my son has eyesight problem. I asked Dr. Rahil about him, and he said once he reaches 20 years, you can bring him here. I'm
Okay.
bringing him here, sir.
Okay, right.
Yes, thank you.
How often do you think you can come to Delhi? Because once you are back in Delhi someday, do come and show back to us.
Sure, sir. Sure, sir. I'll do visit your hospital, sir.
So we like to see how your lens is working after a year.
Yes, sir. Sure, sir.
Right.
Thank you so much, sir,
Okay.
for your time.
Right. Pleasure.
Sir. Eye7 Hospital, you get the best possible facilities, and I'm really impressed with how systematically they work, and they have enough human resources like manpower. Everything, every detail is taken care of, and that's why I was quite impressed. When I first coming from a small state like Sikkim, I thought what would be the reaction of the staff, but then here you are treated like every patient is treated so well, taken care of, every detail is taken care of. That's why even my son has a problem, eyesight problem. He's 19 years old now, and I discussed his case with Dr. Rahil, and he said let's wait for one more year. Once he turns 20, you can bring him here. And whole experience was so good. And then I'm planning to bring my son here for the treatment as well, since I have whatever facilities are provided here, it's so fantastic, and I think my son also deserves such good treatment. So I'm hoping to bring him here. Our eyes are so precious, right? We should get in. It's if you have a vision problem, this is the place to visit and get it treated, because it's a value for money. The money you are spending, you won't feel bad about that, because after all, you are getting such wonderful treatment over here, and this is the best place to visit for your any eye related problem. And in the end, I would like to thank all the staff member, all the especially the doctors, and especially all the staff included in this Eye7 Hospital, from the bottom of my heart, for giving me such wonderful treatment. And then I'm sure I'll be my life will be completely changed after this surgery. And as of now also, I'm feeling so good, and I'm hopeful that in future also the life will be much better than what I had experienced before. Thank you so much, all the team of Eye7 Hospital,